Hello, everyone. On behalf of the Canadian Medical Association, I would like to start by saying congratulations and welcome to residency. My name is Melanie Sterling, and I work in student and resident membership programs with the Canadian Medical Association. I am very excited to talk to you about who we are at the CMA, our vision for the future, as well as the amazing benefits and resources that will help support you through the next stage of your career. If you're not familiar with the CMA, we are the national voice of the medical profession. We represent physicians and physicians in training. We are committed to supporting the medical profession and advancing health in Canada. Our vision at the CMA is to create strong and accessible health systems, fostering well-being and diversity in medical culture, and ensuring every person in Canada has equal opportunity to be healthy. The pandemic has exposed long-standing gaps in the healthcare system and therefore impacted the wellness of Canadians. As we look from what we've been through, we're asking physicians, medical learners, other health providers, patients, and policymakers to join us in co-creating a better future of health for Canada. So in this next slide, we want to share our vision for the future in more depth. We want a sustainable, accessible health system where patients are partners in care. We want communities where everyone has the chance to be healthy. We want a new culture of medicine that embraces equity and diversity and sustains physicians as people as well as professionals. We recognize that the pandemic has taken a toll on the emotional and physical well-being of physicians, medical learners, and healthcare workers across Canada. Now more than ever, physician wellness is a priority. We would like to outline some of the services that are available to support you and your family's well-being. The first is the CMA Wellness Support Line. The support line offers counseling and access to mental health supports to physicians, residents, medical students, and their immediate families. It is a 24/7 bilingual service, English and French, designed to complement existing resources available through physician health programs in provinces and territories across Canada. The CMA Physician Wellness Hub is a hub that can be found on cma.ca and includes over 400 wellness resources for physicians, residents, and medical students seeking guidance and wellness self-help. Included here is the Sound Mind podcast series about physician wellness and medical culture, as well as our pandemic wellness toolkit that covers various topics. Lastly, the Wellness Connection. The Wellness Connection is a virtual, safe space for physicians and medical learners to discuss shared experiences, get support, seek advice, and help each other. These sessions address a range of topics and themes, including stress reduction, compassion rounds, and psychological first aid. The sessions are all free and are all physician-led. Over the next 3 slides, I'll talk about some programs available to you and ways you can get involved with the CMA. The first is through the CMA Ambassador Program. This program is geared exclusively to medical students, residents, and early career physicians. It offers its members a range of opportunities to attend CMA and other health-related events and inform the CMA's work through consultations and working groups. Throughout the year, we connect with CMA ambassadors via email to inform them of upcoming opportunities. Each opportunity helps ambassadors build a different skill set, which we hope they can apply right away in their studies or advocacy work. These events are great ways to connect with physician leaders and engage in conversations. The program is free to members, and to join, all you need to do is complete an application at cma.ca/ambassador. Some ongoing opportunities are the Canadian Conference on Physician Leadership, Canadian and International Conference on Physician Health, Canadian Women in Medicine Conference, Institute for Healthcare Improvement, the Physician Leadership Institute, etc. Coming soon is our CMA Ambassador Community, an online space for ambassadors to connect and make their own. The CaRMS interview prep program is a program that has been growing in popularity with both students and residents over the last 8 years. The CaRMS Prep program offers practice mock interviews for final year students who are preparing for their CaRMS interviews. We recruit resident interviewers for these virtual sessions that run from approximately November to March. Last year, we recruited over 135 residents from across the country to participate. This is a great opportunity to share what you learned during your CaRMS interviews and provide invaluable advice to final year medical students. Lastly, we'd like to share some information on the 2022 CMA Health Summit Series, which is an event we hold annually. This year, the summit includes a series of virtual interactive panel discussions moderated by CMA President Dr. Catherine Smart. Each session is focused on how to do healthcare differently in Canada during COVID and beyond. By the time you are viewing this recording, the series have likely already taken place. However, you are able to access more information on the events, including session recordings on our website. The first two Health Summit sessions, one in English in partnership with the Globe and Mail and one in French in collaboration with l'Université de Montréal, will focus on how to create a health system that is an engine for economic growth. In June, the final Health Summit session will explore how to rebuild the health workforce, including recruiting, training, and retaining future healthcare workers. This virtual session will include small, interactive breakout groups where participants can exchange ideas on specific workforce issues. These insights will help inform the CMA's work on health human resources. Over the next few slides, I'd like to share some technology and resources that are available at your fingertips. As a medical student and through your residency, you are likely well served by your academic institution with clinical information tools, so you may be familiar with some of the resources listed on this slide. CMA does offer some exclusive tools to complement your current access and can help fill gaps now and as you transition into practice. Dynamed is an excellent point of care tool, available online and in mobile formats. We hear from residents that they like Clinical Key for the wide variety of textbooks that are required for exam study, and the Presentation Maker tool that allows you to insert images into presentations. CPS provides current drug and therapeutics information to all CMA members in both online and mobile formats. Infobase is the only central and comprehensive source for Canadian clinical practice guidelines, a unique tool provided by CMA. What one resident had to say: nice accumulation of guidelines, especially for primary care. Great for new staff and residents studying for exams. The complimentary Ask a Librarian literature search service is very popular with residents who may not be confident with their search skills, want to save time, or just want to ensure that their search strategy is robust and that they are not missing any key evidence. Resident members contact us with patient care or clinical research questions, or for assistance with preparing a report, publication, or presentation. Here are a few comments. Thank you for your help in my search. As always, I received more comprehensive and relevant results than I was able to find on my own, with very quick turnaround time. It is such an asset to have skilled librarians with the CMA. Another, very helpful. Having summarized information available is priceless. Thanks. My first time using this service, and it was extremely helpful and a great resource. Will likely use again and will recommend to others. Transition to practice. PMC addresses a gap in medical education, the practical side of starting out in practice. The content for these sessions focuses on how to set yourself up as a physician in terms of choosing the right type of practice, contract negotiation, billing basics, insurance, finance, taxes, locums. These are complimentary full and half-day sessions led by physicians at medical schools across Canada and are popular all throughout your residency training. You don't have to wait until your last year. Upcoming session topics, dates, and times are listed on our website. The next slide is about building leadership skills and networks at any stage of your career. The Physician Leadership Institute offers accredited leadership learning for individuals through open enrollment courses. PLI courses are led by a faculty of expert physician leaders and industry practitioners. PLI offers complementary courses such as Foundation of Wellness and Foundations of Leadership. If you're looking for continuing professional development, there are courses on topics such as communication, influence, negotiation, and conflict management. Courses are offered in both French and English and are currently being delivered virtually. I'd like to touch on a few resources that offer the latest in medical research and innovation. I'll start with Boldly. Boldly is a series of short blogs on topics such as virtual care, COVID-19, innovation, digital health, and physician advocates. The blogs can be accessed at boldly.cma.ca. CMAJ, Canadian Medical Association Journal, is a peer-reviewed general medical journal that publishes original clinical research, commentaries, health news, clinical practice updates, and thought-provoking editorials. CMAJ has had substantial impact on healthcare and the practice of medicine in Canada and around the world. POEMS, or Patient-Oriented Evidence That Matters. POEMS are succinct summaries of the latest clinical studies sent by email. They are very popular with residents as they look to build clinical knowledge and keep up with practice-changing updates. If you're not already receiving them, it's very easy to sign up with one click of a button on our website. One comment from a resident: "Poems are my favorite CMA clinical resource. Brief, effective, and daily messages that help me build my knowledge helps to impress my staff from time to time as well." That brings us to the last slide. We look forward to supporting you through your years in residency, into practice, and beyond. We need your ideas, expertise, and support so together we can build a better future of healthcare for all Canadians. Let's stay in touch. Please take a moment to update your residency school and program information with us so we can update your profile from student to resident. You may also want to update the email you receive our communications on if that has changed since you started medical school. You can do this by simply going to cma.ca/resident. CMA membership is complimentary for medical residents in Canada. You must simply be a member of your provincial association. If you have questions about any of the programs and services I've outlined, or if you have a question on your membership status, please feel free to contact our Membership Service Center by phone at 1-888-855-2555 or by email at memberservicecenter@cma.ca. Thanks so much for your time, and with that, we would like to once again welcome you to residency. Thank you.